Hello, I'm Dr. Elizabeth Kavaler. Pelvic organ prolapse is when organs, including the bladder, uterus, or rectum, feel like they're protruding out of the birth canal. Sometimes these organs literally feel like they're falling out of the body. Treatments can range from pelvic floor physical therapy to a rubber support device called a pessary to surgery. Surgeries can be done safely and effectively, often with a same-day discharge from the hospital.
Dr. Kavaler and her staff provide an atmosphere where, as a patient, you can feel cared for by thoroughly competent staff and a doctor who is totally present, clear, concise, and knowledgeable under circumstances that can be delicate. 5 stars.
There are many safe options to treat pelvic organ prolapse. I work with patients in their first visit to diagnose the issue and to help them make their best decision.
Dr. Kavaler is competent beyond, far better than any of the urologists I have had the misfortune to visit, and she has lovely young assistants as well. I would strongly recommend her to anyone in need of a urologist. 5 stars.
My practice is dedicated to helping women have healthy, functioning bodies throughout their entire lifetime.
Dr. Kavaler treats you as a whole person and takes an interest in your life so that she can help you. Her patience and her caring and her follow-up calms me and gives me the confidence I need to carry on. 5 stars.
To learn more about pelvic organ prolapse, urinary incontinence, or urinary tract infections, call me at 212-218-3900 or schedule an appointment at totalurologycare.com. Compassionate self-pay fees, most medical insurances, and Medicare are accepted. Total Urology Care cares about you. We really do.